Hi everybody, welcome to Dr. Manny's YouTube Learn Shops. This is a continuing session on health assessment for an adult. And in this presentation we'll be looking at the head, in particular the eyes, the nose, the mouth and the ears. So when it comes to the physical assessment, so the body structures in relation to the head and the face that we'll be looking at are the eyes, the ears, the nose, the sinuses, the mouth and the throat. Assessment involves, again, history. Questions that could be asked: do any of your family members have myopia, which is being nearsighted? Hyperopia, farsighted. Strabismus, crossed eyes. Colour blindness, seeing abnormal colours. Cataracts, clouded lens. Glaucoma, a disease that will eventually cause blindness if left untreated. And retinoblastoma, which is a malignant cancer. The images that you're looking at, first one at the top is strabismus, and certainly the second one would be related to cataract. But again, as mentioned previously, what you see is what you know. And the most important thing to see and know is what is normal. Then you can determine whether it is abnormal. Past history is important. Questions could include things like, do you have a history of cataracts, glaucoma, hypertension, diabetes mellitus, thyroid disease? Because all these conditions can affect your eyes. Then you could be asking a question like, have you ever had any injuries to your eyes? Any surgery on your eyes? Have you ever had any facial surgery? Or have you had cataract removal or an implant of the lens? Medication history is important because this can indicate whether there are any issues. Questions could include things like, do you use artificial tears, decongestants, corticosteroids, antibiotics, antihistamines, or prescribed eye drops? Lifestyle behaviour is important as well. So determining whether there are any issues related to lifestyle would be important. Questions could include, in respect to risk factors, do you have any allergies? Are your eyes sensitive to pollen or animal hair, that being dander? How do you react to insect bites? When it comes to eye health, when was your last eye examination? Do you wear glasses or contact lenses? Do you wear goggles or a face shield when you are at work or play sports or do any home projects which could potentially cause an injury? What's your nutritional status? Do you eat a well-balanced meal? Malnutrition or inappropriate foods may result in eye issues. When it comes to clinical manifestations, common eye symptoms could include pain, and a question could be, do you have any eye pain or discomfort? It could be related to trauma. Is your problem related to trauma or an injury? Visual changes. Have you noticed any changes in your vision? This could be peripheral vision, far or near. In respect to blind spots or floaters, such as spot halos or halos around lights, questions could be, have you noticed any blind spots or halos? Is there any eye discharge? Have your activities of daily living changed in respect to your eye problem? Certain external eye disorders could indicate now issues, and Some of them could be these: blepharitis, bacterial conjunctivitis, jaundice related to other conditions, hyphema, exophthalmos, bordelum, which is also known as a sty, glaucoma, amblyopia, also known as the lazy eye, allergic conjunctivitis, viral conjunctivitis, osteogenesis imperfecta, and cataracts. There are also pupil disorders, and the pupils can be classified or identified under these headings: aniscosoria, or the pupils are unequal, which can be normal up to a point, but typically may be related to other disorders. Horner syndrome, Argyll-Robertson pupils, Addy's pupil. Then you've got the keyhole pupil colobloma, meiosis, which is a small fixed pupil. Then you've got oculomotor, third cranial nerve damage. And then you've got madrihiasis, or a dilated fixed pupil. But there are many others as well. What's some of the equipment that might be used for an eye assessment? Well, again, typically you might have a pen light, cotton wisps or cotton tipped applicators, an ophthalmoscope, a Snellen chart for testing far vision, a Jaeger for testing near vision, or even a small Snellen's chart can be used for near vision testing. Occlusive covers for individual eye testing, and the Ishihara plates for colour vision testing. When we're testing visual acuity, or how good your vision is, in respect to distance, the Snellen chart is the tool that is employed. And the procedure basically is to give the patient an opaque card to cover one eye at a time during the assessment. You stand by the chart and ask the patient to read from the top till they get to the smallest letters that they are able to read. Acuity for distance is documented in two numbers, with reference to what a person will normally see, normal vision, at 20 feet from the chart. A person with normal vision, 20/20 vision, can read at 20 feet what a normal eye can read at 20 feet. So, the top mark is the distance in feet the patient was from the test chart, for example, 20. The bottom mark is the number under the smallest line the patient can correctly identify, for example, 40 over 200. The larger the bottom number, the worse the visual acuity. The worst possible outcome is 20/200. Looking at the chart, 20/200 is the largest letter. So at 20 feet, that's the only letter they can identify, the worst vision. At 20/20, they can read the small lines, the small letters, which is normal. Anything below that, your vision is more effective. Visual acuity can also be near. And typically you could use the Jaeger test pocket screener. Near vision is usually assessed in patients older than 40 years or younger. who report difficulty with reading. If no Jaeger test pocket screener is available, ask the patient to read newsprint or from a book or a magazine or a letter or some sort of small print document. You instruct the patient to hold the Jaeger chart, if using the Jaeger chart, 14 inches, approximately 35 centimetres from the eye. And the person should be able to read through the smallest letters possible, occluding one eye at a time with corrective lenses on can also be done. Near vision is typically 14/14 bilaterally. Then you've got visual acuity, which incorporates colour. Now, colour testing can be using the Snellen chart as well, as you can see to the left, or it can be using other tools, which we can see to the left here, that identify certain numbers in different colours and backgrounds. And this chart is the Ishihara cards, which again were created to attest colour blindness. When it comes to testing peripheral vision, both the examiner and the patient should be on the same level, their eyes. The patient is asked to cover the left eye with the left hand. Examiner and patient stand 2 to 3 feet apart, and the examiner presents 1 to 4 fingers midway between the examiner and the patient, and in each of the 4 quadrants. The patient is to report the number of fingers without directly looking at them. They are looking at the examiner's eyes. And then this is repeated with the other eye, and the patient should accurately report the number of fingers presented in all 4 quadrants. The 4 quadrants are superior temporal, superior nasal, inferior temporal, and inferior nasal. And both should be the same. When we look at extraocular muscle movements, well, this is a muscle functioning test that examines the function of the eye muscles. And this test is essentially performed to evaluate weakness or problems that may result in double vision or uncontrolled eye movements, which could be nystagmus. Now, the examiner or assessor asks the patient to look in 9 directions by following a finger object as he draws a H pattern in the air. The patient sits or stands, their choice, with their head up and looks straight ahead as the examiner moves a finger or an object, could be a pen, in 9 directions. The patient will be asked to follow with their eyes without moving their head. The normal results are the movement of the eyes in all 9 directions. Another assessment is the corneal light reflex. And this is a test to look for crossed eyes, which is strabismus. And this is where you instruct the patient to stare straight ahead at the bridge of your nose, the examiner's nose. You stand in front of the patient and shine a pen light at the bridge of the patient's nose, and you note where the light reflects on each cornea. Now, normally, the light reflection is in exactly the same spot for both eyes if there is no strabismus present. If the light reflection, as in the bottom image, are not the same, there is a strabismus, or the eyes are not functioning correctly, as in a strabismus. When we assess the pupil light reflex, this is to assess cranial nerve 2 and cranial nerve 3. and you stand in front of the patient. You use your pen light to observe the pupil shape and size and determine the millimeters. The pupil is black, round, equal, with a diameter typically in ambient light between 2 and 6 millimeters. You shine the light directly into the right eye and you observe the pupillary constriction, which assesses cranial nerve 2 and 3. You repeat this procedure, observing the left eye for pupil constriction, which is consensual. You repeat these two procedures in the left eye and the right eye. And normally the pupils constrict directly and consensually. Then we have what's called the accommodation reflex, the pupil accommodation reflex. And this tests for pupil accommodation, which is cranial nerve number 3. And this is where you instruct the patient to stare at a distant object for 30 seconds. You hold an index finger or an object, let's say a pen, about 14 inches, 10 centimeters in front of the nose. You ask the patient to focus on your finger or the object as you move it towards their nose. Normally, the pupils constrict, which is accommodation, and the eyes cross and converge towards the bridge of the nose, as you can see in the images. Continuing on, when we look at the ears, we establish a family history as well. So the questions could be, do you have any family members that have had some sort of ear problem? If so, who had the illness? What was the illness? When did the person have it? How was the illness treated? And what were the outcomes? And this could include things like an earache, infection, earwax, fluid in the ear, hearing loss, acoustic neuromas, or deafness. Past history is important as well. So questions could be, how do you protect your ears from the sun? How often do you wear a hat? How often do you apply sunscreen? And it could even be related to noise. How do you protect your ears from loud noises, loud music? Again, other questions could involve things like, have you been diagnosed with an ear infection, hearing loss, tinnitus, vertigo? Have you had injuries to your ears? Have you ever had any surgery on your ears? When it comes to medications, there are medications that can affect your hearing. So questions could be, do you use over-the-counter medications? Do you have any medications that are prescribed? Because as I said, some medications are ototoxic or can cause hearing issues. If so, how often do you take them? What dose, what route? There are certain disorders or infections which again can affect hearing. So a question might be related to, have you received any immunisations? And if so, has it been for mumps or rubella? Because these can cause hearing anomalies. And if so, when was your last vaccination? And did you receive all the required doses? A good mnemonic, as indicated to the right, about ototoxic drugs is calm ear, because there are certain medications that can now affect your hearing. What about lifestyle behaviour? Questions that relate to lifestyle, questions could relate to risk factors. Are you exposed to loud noises? When were you exposed to them? What protective ear equipment did you use? Do you smoke cigarettes? How long did you smoke? Do you have any allergies? Do you travel by plane? How often do you travel by plane? In respect to ear health, do you clean your ears? And if so, did you have any ear examinations? And when was your last one? If there are issues, you could be asking here, do you ever wear a hearing aid? Do you have a hearing aid? Some of the common ear symptoms that can occur are things that relate to hearing loss, vertigo, tinnitus, which is a ringing or humming sensation in the ear, otalgia, pain. Pain, otalgia, you could be asking, do you have any ear pain or discomfort? In respect to trauma, is your problem related to trauma or an ear injury? Have you noticed any recent changes in your hearing? Are you having any ear discharge? Has your ear problem affected your ability to perform your activities of normal daily living? When it comes to equipment, in respect to ear assessment, the otoscope is commonly used to look inside the ear for issues. And these could relate to earwax buildup or signs of infection. A tuning fork, we can now vibrate to assess hearing, which could be related to air conduction or bone conduction. And there are two tests, the Rinne test and the Weber test. Or another tool can be the curette, which is a long, thin instrument used by a professional who knows how to use it. And with this tool, a small scoop on the tip that fits in the ear canal is used to scoop out any wax that may have become compacted. Or an irrigator can be used to flush out earwax or debris from the ear. When we do an ear assessment, we typically use inspection. An inspection, when we look at the ears, they should be symmetrical, equal size, fully formed, ear tone is uniform with the face, and the skin is intact. Abnormal findings might be small ears, abnormally large ears, microtia, macrotia. Edematous ears, cartilage pseudomonas infections, carcinoma on the auricle, cysts, and if living in a cold environment, possibly frostbite. Some of the external ear disorders include small ears, microtia, very large ears, macrotia, edematous ears, ears that are affected by certain infections, carcinomas, cysts, topy, and external otitis. The other tool that we use is palpation. And we palpate the outer, the auricle, and determine whether there are any lumps, whether they're firm and not floppy. Lymph tissue isn't palpable, but the ears can be tender or non-tender. They can have pain or be pain-free. Other assessment tools can be the whisper test. The whisper test evaluates the loss of high-frequency sounds. So what do? You instruct the patient to plug or cover, or you do it, the ear opposite to the one that you are testing. With your head 18 inches from the patient's ear and your mouth not visible, you whisper a simple sentence. For example, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. or A, B, C, D, E, F, G, H, I, J, or my name is. You have the patient repeat what you have said, and then you repeat this procedure on the opposite side. Normal hearing, the patient repeats the entire sentence without any errors. An additional ear assessment tool is called the Rennie test. And this uses a tuning fork to establish if hearing in both ears is equal. If there's either a conductive or a sensorial neural hearing loss, the test allows comparison of the difference in bone conduction versus air conduction. Now, conductive hearing loss on one side may indicate an external or a middle ear problem. However, first of all, we look for a blockage in the external auditory canal, and the tympanic membrane should be assessed to ensure that there is no middle ear anomaly, such as, for example, fluid or tympanic membrane perforation. In the Rennie test, the procedure is to grasp and tap the handle of the tuning fork against the back or the heel of your hand. You place the base of the handle on the patient's mastoid process. You note the time on the second hand of your watch. You instruct the patient to say when they no longer hear the sound. You note the number of seconds. Then you move the tip of the tuning fork to the front of the external auditory meatus. Again, you note the time of the second hand on your watch, and you instruct the patient to report when they no longer hear the sounds. A positive result is the AC is twice as long as the BC. The Weber test is another test. However, this differentiates the cause of unilateral hearing loss. After activating the fork, as previously, place its handle on the midline of the parietal bone in line with both the ears. Normally, the patient will hear a sound bilaterally in both ears at an equal intensity. However, with unilateral identification, the sound indicates sensor neural loss in the ear, that the patient didn't hear or feel the vibration, or there was reduced sound perception. Sensory neural hearing loss in one side may be related to disorders such as Meniere's disease or a vestibuloacoustic neuroma. Now we move on to the nose, the sinuses, the mouth and the throat. And family history again is important. Questions could be related to, do you have a family history of mouth or upper respiratory tract disorders? If so, who had the illness? What was the illness? How was it managed? And what was the outcome? And this could include things like nosebleeds, epistaxis, foreign bodies, nasal polyps, allergic rhinitis, chronic sinusitis, deviated septum, cleft lip palate, tonsillitis, herpes simplex, candida infections, dental caries, gingivitis, ankylosing glossia, and cancer. Disorders could include things like, as we said, epistaxis, foreign body, a deviated septum, perforated septum, cleft lip or palate, bifid uvula, Kaposi sarcoma, acute tonsillitis or pharyngitis. Other disorders could include streptococcal infection of the throat, herpes simplex virus, candidiasis, torus palatinus, canker sores, which are ulcers, leukoplakia, a black hairy tongue, carcinoma, cancer. When it comes to assessment, past history is very important, as it is with all conditions. Questions could include things like, have you ever been diagnosed with a mouth or upper respiratory tract condition? If so, what was the specific condition? When did it occur? How was the condition treated? What were the outcomes? Did you have any chronic upper respiratory tract infections as a child? A positive history of frequent upper respiratory tract infections suggests possibly an underlying allergy, adenoids or tonsil issues, chronic sinusitis. Medications again are important. Questions could include, what medications do you currently use? Are they prescribed or over the counter? Or are they herbal supplements? And it's important to know the names, the doses and the frequencies. Some medications got side effects that do affect the nose, the mouth, the sinuses and the throat. And especially blood pressure medications, antihypertensives, can produce a cough. Anticoagulants may lead to bleeding problems. Other medications can dry the mouth, which may affect your oral health. Lifestyle behaviour is important in this situation as well. So questions could include about dental health. How often do you brush your teeth or floss? When were your teeth last cleaned? Do you have any tooth or gum issues? There could be a psychosocial history. Do you currently smoke cigarettes, pipes or cigars? And if so, how many packs do you smoke per day? How much tobacco do you smoke every day? How many years have you smoked? Have you ever tried to stop? In addition to that, it could be related to chemical substances. So are you exposed to chemical substances or irritants at your workplace? Do you take precautions to protect your respiratory tract? Do you have hobbies that increase the risk of upper respiratory tract problems? For example, things like farming, exposure to animals, exposure to paint, chemicals, fumes, wood dust, flying in an aeroplane, scuba diving, swimming. Take note, smoking increases the risk of respiratory inflammation, exacerbating allergic rhinitis, and exacerbating chronic sinusitis and causing cancer. Cigarettes and chewing tobacco also increase the risk of oral cancer. What are some of the symptoms that may occur as a consequence of these issues related to the nose, the sinuses, the mouth and the throat? Well, facial pressure and pain headache. This can be commonly caused by sinuses that are inflamed or maybe colds, influenza. Signs could be related to sleep apnea, which could be snoring. And with this condition, there's a risk of stroke, hypertension, heart attack, and accidents. Obstructive breathing can be related to a deviated nasal septum, nasal polyps, or a tumour, which cause nasal obstruction. Or the trauma may lead to a deviated septum or a hematoma forming. Nasal congestion can be clear nasal discharge or clear rhinorrhea. But however, this can be related to allergies or non-allergies. And then if discoloured or cloudy, may indicate infection and inflammation. Epistaxis is basically nosebleeds. And this is primarily occurs because of inflammation of dilated blood vessels in the nasopharynx. Or maybe you are a constant nose picker, which may aggravate nasal bleeding. Other issues may be related to bad breath, halitosis, which may indicate that you have got an infection. But it can also be associated with fasting or not eating or not drinking enough fluid. Other symptoms could include that you're not smelling properly, anosmia, you're having a cough, a sore throat, difficulty swallowing, tooth pain, voice changes, and oral lesions which are identified, which could be caused as a result of tobacco. Equipment that's used for the nose, sinuses, mouth and throat include an otoscope, a nasal speculum, tongue blades, cotton gauze, a pen light, gloves, or a scratch and sniff test card, and a nasopharyngeal laryngeal mirror to identify if there are any lesions or disorders in the oro and nasopharynx. If we are assessing the nose, we would be inspecting the nose externally, and it should be symmetrical, midline, and in proportion to the face. The skin surface should be smooth, without any lesions, and the colour is consistent with the facial complexion, continuous. If internal nose inspection is done, then here the advanced practitioner, nurse or healthcare provider inspects the internal nose with an otoscope and a nasal or nasal speculum. Palpation typically isn't required. However, if done, gently palpate with the thumb and the forefinger, and if there's a problem like pain, tenderness, or a break in the contour, it will be identified. Assessing the sinuses. This is where we use the techniques of inspection, palpation, and percussion. With inspection, we inspect the frontal and maxillary sinus areas for redness or swelling. The findings typically are symmetry with no redness or swelling. Redness and swelling, however, may represent an acute infection, abscess, or mucocele. Palpation and percussion. Palpation and percussion is of the frontal and maxillary sinus areas, and typically direct percussion is utilised. When we inspect the mouth or assess the mouth, the external inspection includes seeing that the lips, their colour, moisture, lesions and oral hygienes are normal. The lips are typically pink and moist with no lesions. When you inspect internally, you're looking at the buccal membrane or mucosa, which is pink and moist. And you note the number and position of the teeth, their appearance, any signs of decay and alignment. And absolutely, the breath odour is noted. A pen light is typically held in the non-dominant hand, and a tongue blade is typically held in the dominant hand. And the mouth is opened, and you note the colour and the surface of the hard and the soft palate. Internal inspection of the mouth also involves holding a light in the non-dominant hand and tongue blade again in the dominant hand, and you inspect the tongue, looking at the dorsum, the back, the sides and underneath. You note the papillae. You ask the patient to stick out their tongue and you have them say ah, and you watch the rise of the uvula. To test the gag reflex, gently place a tongue blade on the posterior dorsum, and this will typically have the patient gag slightly. On palpation, you can palpate the parotid, submandibular and sublingual glands for swelling or tenderness. Make sure you use protective personal equipment such as a glove. And always inform the patient about what you're going to do. When we assess the throat, we use inspection. Inspection, you press down slightly on the tongue with the tongue blade on the midpoint of the tongue. You visualize the pharynx, tonsils, soft palate, anterior and posterior tonsillar pillars. And you note the colour, symmetry, enlargement, and any lesions. The tissue is typically pink and moist and symmetrical. There's no enlargement or lesions noted, and the tonsils can be graded from 1 to 4. So let's review. 4 clinical manifestations of an eye anomaly could include infections, redness, excessive tearing, halo around lights, blurring, loss of side vision, moving black spots, flashing lights, double vision, eye pain. Manifestations of an ear anomaly could be related to hearing, tinnitus, ringing noises, tinnitus, buzzing noises, earaches, drainage, dizziness, loud noise issues. When it comes to the nose, the mouth, the sinuses, the throat, clinical manifestations could include issues related to the teeth and gums, their condition, sore throat, mouth lesions, hoarseness, rhinorrhea, nasal obstruction, frequent colds, sneezing, itching, nosebleeds, snoring. Okay, that's the end of this session. Thank you again for attending. If you find that these Learn Shops are of any benefit to you, please recommend them to your colleagues and your friends, and subscribe so that you can be notified of any future Dr. Manny Learn Shops. Take care and God bless.